Hello everyone, it's your next door nurse Florence and you're welcome to my YouTube channel. Today we're going to be talking about heart attack and cardiac arrest. If you're just joining us, you're welcome to the family. Kindly subscribe, click on the notification bell so you'll be the first to know when I upload new videos. Give me a thumbs up by clicking on the like button. Without wasting much of our time, let's go into the topic. Heart attack is a blood flow problem. It occurs when one or more of the arteries that supplies blood to the heart is blocked. So or is interrupted. When this happens, you say someone has heart attack or myocardial infarction. Usually it is caused by a blood clot. That's a cluster of blood that changed from liquid to jelly-like or solid state. There are some risk factors to heart attack or myocardial infarction. We have the non-modifiable risk factors, that's the risk factors that cannot be changed, and we have the modifiable risk factors, those are the risk factors that can be changed. For the non-modifiable risk factors, that's the risk factors that cannot be changed, we say we have age. Usually people that are above 65 years of age, they are more at risk. We have sex, men are more at risk. We have people that have a family history of maybe either of these disease conditions like hypertension, diabetes, obesity, or heart conditions. And we also have race. It is said that Africans are more at risk of developing myocardial infarction or heart attack because we have a high prevalence of diabetes and hypertension. The modifiable risk factors, that's the risk factors that can be changed, are obesity, smoking, lack of exercise, diet, alcohol consumption, and high cholesterol. The signs and symptoms of heart attack includes crushing chest pain, when the person feels as if there's an elephant sitting on the chest. You have shortness of breath, there's sweating. In women, they can have jaw pain, tiredness, dizziness, feeling of nausea, that you feel as if you want to vomit, and for some of them they even have feeling of indigestion. There's fainting spells, they feel faint. Heart attack may occur suddenly but usually builds in intensity over minutes to hours. What do you do? Firstly, you have to keep the person calm, or you yourself, you have to be calm. If you're having shortness of breath or the person is having shortness of breath, you can prop the person up or put the person in a sitting up position. Then if the person is having fainting spells, like the person is feeling like fainting, what you do is that you lie the person flat on the bed or on the ground or wherever the person is. You need to find out from the person if he or she has allergy to aspirin. If not, give them 1 tablet of aspirin, because aspirin is a blood thinner to help the blood flow properly through the arteries. Then you seek medical help or take the person immediately to the hospital. Not forgetting that the first 90 minutes of treatment increases the chances of survival. If not, that person can go into cardiac arrest. Cardiac arrest is caused by electrical problems within the heart. Normally, the heartbeat is controlled by electrical impulses. So when the reading of the heart stops, it is referred to as cardiac arrest because it is caused mainly by severe abnormal heart reading. For the signs and symptoms, the cardiac arrest victim becomes unresponsive and stops breathing or is gasping for breath. They can fall into unconsciousness almost immediately, and the skin can become pale or blue. So what do you do in this condition or in this situation? You activate the emergency response by calling for help. That means you get help immediately. You check for responsiveness by tapping and shouting the person's name. You check for pulse by placing the index and middle finger on either side of the neck to locate the carotid artery, simultaneously checking for breathing or gasping by placing your ear close to the person's mouth, and this should not be done for more than 10 seconds. If you cannot feel any pulsation, movement of the artery, or breathing, commence cardiopulmonary resuscitation immediately. Cardiopulmonary resuscitation is done by locking your hand like this placing the heel of your hand on the center of the person's chest. Then you apply pressure, that's you press down 5 to 6 cm at a steady rate of 100 to 120 compressions per minute and ensure complete chest recoil. You give 30 compressions and 2 rescue breaths. After 5 cycles, you seek medical help immediately. But if you were there when the person became unresponsive, seek medical help immediately before you start cardiopulmonary resuscitation. In summary, heart attack is a blood flow problem and it is caused by a blood clot, while cardiac arrest is an electrical problem within the heart and it is caused by severe abnormal heart rhythm. In heart attack, there is crushing chest pain, while in cardiac arrest, the person or the victim is unresponsive. So guys, give me a thumbs up if you find this content helpful by clicking on the like button, subscribe, click on the notification bell so you'll be the first to know when I upload new videos, and drop your comments in the comment section below and I will attend to them. Don't forget, I'm your next door nurse and I'm just a knock away. I love you guys. See you in my next